Thank you for joining us this morning. As you know, the FDA has approved an extended use authorization for the Pfizer mRNA vaccine. Additionally, the ACIP has provided guidance on how we should administer this vaccine to our caregivers in a safe manner. We are excited at Intermountain Healthcare to be able to offer this to our caregivers as a safe prevention from COVID-19. 2 of our facilities we know have received vaccine at this time, Utah Valley and the LDS Hospital, and we anticipate that several of our other facilities should receive it either tomorrow or by the end of the week. In terms of a timeline moving forward, we will begin vaccinating our caregivers this week with the most likely start date of Wednesday afternoon. We will begin by vaccinating caregivers with those who are the most highly at risk of exposure to the virus that causes COVID-19. These would include those who work on our COVID units, our ICU care doctors, nurses, technicians, those who work on medical units, those who work on our environmental services and deal with COVID-related waste, those who are in respiratory therapy who help others breathe more safely when they are sick. All of these will be in the first stages, but all healthcare workers are in Part 1A of this vaccine distribution, and we are excited to be able to offer it to them. In order to ensure that our caregivers are safe as we go along, we will have a robust tracking system in place for anticipated adverse events. We will report it via vSafe, which is the CDC application for smartphones, if the caregiver wishes. We will also have an employee health resource for those who feel symptoms, and we'll be able to support our caregivers if they are unable to attend work. At the same time, we will be working with our units and our facilities to ensure that we are administering the vaccine at a time when the healthcare worker can potentially be at home, so they can feel those symptoms potentially at home, and then ultimately come back to work developing antibodies without symptoms. In terms of the process of receiving vaccine, we initially received vaccine through our materials management, it was immediately transported to our pharmacy. This is to ensure both temperature, stability, and security of the vaccine. To receive the vaccine, it is then thawed, either at room temperature or in refrigeration. That can take from 30 minutes to up to 3 hours. Once it is then put into a diluent, a fluid to be administered, it will be placed into syringes that are pre-measured so that there's no risk of unintended dosages at the bedside. So they'll be in pre-filled syringes. They will then be needed to be administered within 6 hours to ensure stability, and will be administered in one of our facilities immediately. We will be scheduling our caregivers to ensure their safety during this time when we want to not have crowds, for example, in one place, all getting it at the same time. This will also ensure that we can schedule it for our units as well and maintain our staffing capabilities. Thank you very much. And as I mentioned, we are very excited to be able to offer this to our caregivers.
Thank you, Dr. Dascomb. We'll have Dr. Stenehjem next. I should mention, please put questions that you have in the chat, and we will answer them following Sean Talley. Dr. Stenehjem.
Thank you, and thank you to Dr. Dascomb and her team, who has worked absolutely tirelessly to bring this vaccine to Intermountain and to the state of Utah. And thank you for joining us on this absolutely historic week in healthcare. 16 million cases of COVID-19 across the U.S. as of this morning, and 296,000 deaths across the U.S. due to COVID-19. Of those deaths, 1,055 of them are our fellow Utahns. More deaths will come. More deaths will follow these, but we come to you today with optimism and with hope. All of our lives have been touched by this virus. Some certainly more than others, but all lives have been impacted. Social circles have been disrupted, schools have been canceled, jobs have been lost, loved ones have become sick or have died, and the mental health struggles of getting through this pandemic that has lasted over 9 months cannot be overstated. However, today we come to you with optimism and with hope. Today signals the beginning of the end of this pandemic here in Utah. We now have a new and effective tool to combat this pandemic. In addition to the public health measures which we know that work, social distancing, wearing a mask, washing our hands, in addition to the new medications that we have developed in the past 9 months, remdesivir, steroids, monoclonal antibodies, we now have a vaccine to prevent this infection from becoming worse. This is a proud day for science, and it's a proud day for medicine. In 11 months, scientists have had a singular focus around the globe. We have all been focusing on SARS-CoV-2 and how to maintain the health of our communities. That focus, that dedication, has now paid off with a vaccine that is both safe and effective. This is an absolutely astonishing accomplishment to have done in 11 months. We do want to say thank you to all the participants across the globe who has participated in these clinical trials. Without you, we wouldn't have this vaccine here today. And it's with that help and with that trust in science that we're able to now roll this out across the state of Utah. We also want to say thank you to the Operation Warp Speed leaders for this. They are the ones that took away the barriers for us to move forward quickly without compromising safety to bring a vaccine to the state of Utah. I want to reassure everybody that our group of infectious disease physicians across Intermountain Healthcare have spent time with the data in this vaccine. We've looked under the hood, we've reviewed the publication, the New England Journal of Medicine, the data submitted to the FDA, the data submitted from Pfizer, and we all feel that this vaccine is safe and effective. We feel that this vaccine needs to be deployed in our healthcare settings and in our communities as soon as possible. And just to reassure everybody, we also will be getting this vaccine as soon as it is available to us. We have absolutely no hesitation to be personally vaccinated with this vaccine. There are still many, many questions as it pertains to this vaccine. How long will protection last? Will it prevent me from getting infected, or will it only prevent me from actually getting sick from the virus? We won't know the answers to these questions for quite some time, and we will work with our leaders and with the scientific community to get answers to these questions. In addition, other vaccines will come. Mrna vaccine will be evaluated by the FDA this week. Johnson & Johnson and the Oxford group are not far behind. The more vaccines we are able to bring in and get FDA EUA, the faster these vaccines can be deployed into our communities. Think of this vaccine as the light at the end of the tunnel. However, that tunnel that we're in is still quite long. We are still months away from widespread vaccination in our communities. So what do we need to do to span this gap from where vaccine is now in Utah to where we have widespread vaccination in our communities? Our numbers of COVID-19 cases are improving, and that is a testament to everybody's public health consciousness in terms of preventing the spread of this infection. However, our community transmission rates are very, very high. There's no sugarcoating that we are still in the throes of a global pandemic that is affecting Utah very, very hard. Case in point is our referral ICUs are at 101% capacity as of this morning. Our admissions for COVID-19 to all of our hospitals across the state are very, very high. And our healthcare workers are tired and fatigued and continue to see these patients day in and day out. We want to commend everybody for their efforts at Thanksgiving. We expected to see a very significant surge in cases after the Thanksgiving holiday, and we did see an increase in cases, but it was muted. And that is because of all of the public health measures that so many of you followed for the Thanksgiving holiday. Our message for Christmas and Hanukkah and the holidays that come will be the exact same as that for Thanksgiving. We're encouraging everyone to enjoy those holidays with the people inside your home. Do not gather outside of your home to enjoy those holidays. We cannot tolerate continued surges of cases and then subsequent hospitalizations We need to make sure that we control this from a public health standpoint until that vaccine is widely available in the months to come. And for that, I'll turn it over to Lance.
Thank you, Dr. Stenehjem. Now we'll have Sean Talley from Intermountain Medical Center speak to us on the caregiver perspective.
I'm a nurse manager of Shock Trauma ICU here at Intermountain Medical Center, and myself, like many other units, caregivers here at many different hospitals, we're just kind of in the daily grind of taking care of patients and doing what we do best, which is being flexible and adjusting to the situations and volumes and different types of patients that come across. I think we've done a great job of taking care of the community in general, as well as these COVID patients, which has been quite a challenge. The good news is that this vaccine is finally here, and I think it's a very good, optimistic sign that we are kind of entering a different phase of this. And a lot of the nurses that I talk to and other caregivers are very optimistic about getting it. I have a lot of them asking me, hey, when can we get it? They're wanting to get going because they know it's a good tool to assist us in continuing this fight that we seem to be in. And so we look to it with optimism, and I'm glad that we can finally get started down this path. We still aren't out of the tough part yet, but this is a good start down the right path with this. And so a lot of these caregivers, it's not just nurses and it's everybody, respiratory therapists, and you could name the list. There's a lot of caregivers that really work very hard, and it takes everybody. It takes every single one of them, down to the maintenance folks that are fixing these rooms and a lot of wear and tear that are going into them. It takes everybody, and they're doing a really good job. So that's really all I had to say from the caregiver's point of view. We're still in it. We're still doing a great job, and this is going to be an excellent tool to get started down the right path.
Thank you very much, Sean. Okay, now we'll, as we say, if you want to put your questions in the chat, we've got several, and we'll kind of break them up between our experts here. So first off, Sean Means from the Salt Lake Tribune is asking, why wait until Wednesday? I'm assuming that's in administering the vaccine. He's also asking, we've had several people ask for the same question of how will regular folks know when it's time to get the vaccine?
Thank you for asking. We are waiting until Wednesday only because we need to be able to set up caregivers to be able to administer those vaccines safely. We need to have our caregivers sign up for appointments and have them lined up. As you know, the vaccine is only stable for 6 hours, so we want to make sure we have sequential appointments and all our caregivers are in line before we schedule someone to administer that vaccine. We also want to make sure we have a clean area to administer that vaccine and prepared caregivers to administer it. That they've been prepared, that they've taken all of the trainings that are required. And so in order to ensure all of that is available to them, we are going to wait until Wednesday evening to start our initial vaccination. We will happily announce when we are ready to do our community vaccinations. We will start with those who are at highest risk, those who are over 65, and those who have comorbidities. We will use our data analytics to identify those who are within our Intermountain medical community, who we care for, to actively recruit them to receive vaccine as early as we can, likely sometime in the new year, very early. Once that begins and we feel we've covered as much as we can, we are anticipating in the second quarter of the new year that we will open it up to our community, either by somewhere between March and June. So we're looking forward to announcing that in the future.
Dr. Dascomb, just yeah, I'll throw a couple of them
Sure.
at you here, and then I'll give you a break. I also had the question, this one from Andy Griffin, KDXU Radio, and Salt Lake Tribune. Both are asking, how will those who get the vaccine first be notified?
They'll receive 2 emails. One is from our central group stating that your work group is being offered the vaccine at your facility. Here's what you are to expect of the vaccine day. how you will sign up for an appointment through your email, how you will come during that day, what you will expect to have to do, things like scanning a QR code if you're able to. If you're not able to do that, what the other means of registration are, and then showing up that day at your time, already having anticipated and educated to both the EUA itself as well as a CDC guidance that is designed to give a more easily understood version of the adverse events, as well as the guidance on who can or who does not receive the vaccine, and ultimately administering the vaccine that day when they receive that second email that gives them that invitation. So they have their time, they know what to expect that day, and they can come being prepared and ready to receive it safely.
Tim from the Standard Examiner is asking you to go just a little bit deeper into what's the order of the different groups that will be vaccinated. When will the public likely get it?
Well, our initial caregivers, as I mentioned, will be those who are most exposed. Those include, as I mentioned, our medical floors, our ICUs, our environmental service workers who are exposed to waste. We will expand that then to other folks in our hospitals, as well as potentially even other folks at other hospitals who don't yet have vaccine access, but who are in those job areas. We have caregivers across our system who are taking care of COVID patients. We want to ensure that they have access as well. As we go further into it and have more access to more vaccine, we can then offer it to those who are in primary care and even extend it further beyond. Once we have exhausted what we feel like is our caregiver population, as well as our long-term care facilities and our patients within those facilities, we would then consider moving on to our high-risk patients, our over 65, and those who have comorbidities. We anticipate that could be anywhere between January and potentially March. We hope to start that earlier rather than later.
And I think it's also important to stress that we will be partnering with local health and other organizations as well on this effort. Okay, one more question, then we'll give you a break. This is from Melissa Anderson. I lost it. Okay. Well, we'll just go back to there we go. Sorry about that. Melissa Anderson from CEC Television, and I'm going to alter this question just a little bit. She asked, "What will you do to ensure that you have enough frontline care workers to cover for those who suffer from side effects or expected adverse conditions from the vaccine and are needed to stay home?"
Certainly. So we have a couple of options that we will be using. First is if our caregivers are sick enough to stay home, we will offer them that opportunity. We want them to get better, and we will find a way to staff our facilities. However, for those that do want to come back to work, we will likely perform testing to ensure that they can safely come back to work with an antigen test. That, of course, as per CDC guidance, presumes that they only have adverse events that are associated with the vaccine, such as fevers, body aches, and headaches. If they have any symptoms that are consistent or specific to the COVID-19 virus, SARS-CoV-2, such as sore throat, rhinorrhea, or loss of taste or smell, or cough, then we would be more aggressive in pursuing a COVID-19 diagnosis, have them stay home, and test them for COVID at that time. We'll do our best to keep our caregivers scheduled in a way that's at the end of their shift week. So if they're finishing up their week of work, we get it to them on that last day so that potentially they would have adverse events while they're at home and can recuperate and come back to work safely.
Thank you, Dr. Dascomb. We'll let you take just a little break here, and we'll let Dr. Stenehjem field a couple questions as you're coming to the microphone. First off, asking for ICU status update. How are Intermountain hospitals looking?
Yeah, just like the rest of the ICUs across the state, the Intermountain ICUs are still very, very full. We continue to open up new units and new beds to be able to accommodate the number of ICU patients that we currently have. And so the numbers that are reflected from the state are very similar to the numbers that we're feeling here in our Intermountain facilities. Keep in mind this ICU surge was predicted. First comes cases, then comes hospitalizations, and then comes ICU admissions. And ICU admissions, as in contrast to the general floor admissions, have a tendency to stay in the ICU a long period of time. And so it comes to a situation where we're adding more and more people to the ICU in a quick pace, and they're not being discharged from the ICU as an equally quick pace. And so it becomes very challenging to be able to manage that number of patients.
Thank you. And Chris Reed from the St. George News is asking, is Wednesday the expected date of the arrival of the vaccine at Dixie Regional Medical Center? And what is the plan for distribution there?
Dr. Dascomb says we anticipate it there by the end of the week.
I'm sorry, can we scroll back up just a little bit? There we go. There's the question I was, a little farther. The question was, oh, here we go. What do we know about the vaccine and how it will protect us? You mentioned, Dr. Stenehjem, that there's a lot of questions. What is certain about the process?
So the studies that have come out now in relation to the Pfizer vaccine looks at the efficacy of the of the vaccine after 2 months of follow-up in patients. And in that follow-up data, it's shown to be 95% effective in preventing symptomatic COVID-19. And so the studies are continuing to be ongoing. Those studies will go for 2 years to really assess the longevity of the immune response as it relates to protecting us against symptomatic COVID-19. But all we can say right now is that at the 2-month point, starting from 7 days after that second vaccine, which is given 21 days after the first, after 2 months from there, we have 95% effectiveness for this vaccine, which is absolutely outstanding.
Excellent, thank you. Okay, let's have Dr. Dascomb return to the podium. Sophia from the Associated Press is asking, how many doses have been received by Utah Valley and LDS Hospital? When do those shipments arrive?
Well, we know we have visualized 2 boxes for Utah Valley. I anticipate that it's the same at the LDS hospital, although I have not had immediate confirmation of that because I believe they just arrived. So it's probably approximately that at both hospitals. And what was the second part of the question, please?
How many doses?
Each box is usually about 975 doses, so we estimate approximately 2,000 doses at Utah Valley.
Okay. Kind of a follow-up to that. Carter Williams asks, what determines the number of doses each hospital gets in the state and in the nation?
In the short term, it is based upon the hospital, the number of workers and the number of patients that the hospital is taking care of with COVID-19. In the initial phases, it was allocated based on where those COVID patients were and where our workers were most exposed. And so, of course, there were at the university, for example, Intermountain Medical Center, at the LDS Hospital, and Utah Valley. As we had more vaccine available, as production increased, we were able to expand that to more facilities. And over that time, as Dr. Stenehjem mentions, our ICUs and our medical surgical floors expanded across our system to many facilities now taking care of COVID patients. Consequently, we would really like to expand that as rapidly as possible. And so we will do so as best we can, vaccinating those caregivers in the hospitals that receive the vaccine first, but ultimately getting to those caregivers in the Tier 1 category, that 1A category, from other facilities as well to really get it out as quickly as we can.
And when do we expect the remaining Intermountain hospitals to receive vaccine?
We anticipate several by the end of the week. Other facilities will be following very shortly behind. Many facilities, not all can accept -80 freezer space, but we are getting that rapidly. And so we are hoping that by next week we will have several more, but we don't have dates for any of the other ones as of yet, so I can't give any dates at this time.
Nick Aaron from ABC News asks, can you please address the rumor that Utah political leaders and their families are somehow receiving priority to access the vaccine?
At this time, we have no plans to give out vaccine to any community members at this time.
Okay. Already discussed that one. John Reed asks, are any healthcare workers opting out of taking the vaccine?
We are not making it mandatory, and so we are just starting our process to invite caregivers to do so. I will be able to answer that question potentially at a later date, but right now we do anticipate that about 70% of our caregivers will accept the vaccine in the short term and possibly more rapidly thereafter as acceptance and understanding of it continues in the community.
I'm sorry, I'm trying to read these as we go. UDOH said it is likely that we'd be seeing vaccine for the general public by July. Have projections changed with the Mrna AstraZeneca vaccine coming?
I think that is July is certainly a date that's about at the middle of the year next year. We do anticipate that as we go along, we'll hopefully be able to expand our ability to administer the vaccine and therefore hope that we can meet a quicker timeline. But yes, that is certainly the latest timeline we'd like to see as our projection for being able to administer vaccine to our community.
Okay, what about second dose? How soon will that happen?
The Pfizer vaccine requires a dose within 21 days. Our caregivers will receive an automated email to remind them of their need to schedule a second appointment. They will also receive a second email if they don't schedule it in a timely enough manner. We will ensure that they get that second dose to really develop their immune system so that we can have good responses to the vaccine in all of our caregivers.
Okay, let's have Dr. Stenehjem come back. Okay, question, what does it mean when the vaccine is stable?
Yeah, so good question. This vaccine that Pfizer has developed is a messenger RNA vaccine. RNA, just the nature of RNA, is relatively unstable, meaning that it will degrade quickly. And so the reason that this vaccine needs to be transported at such cold temperatures is to make sure that it isn't degrading. And so the vaccine that we administer to our healthcare workers in the community is just as effective as those in the study trials. And so the temperature is very important to the stability of the RNA.
Excellent. Let's see. Is there a timeline for the Mrna vaccine that will arrive that doesn't need to be super cooled?
Yeah, so the Mrna vaccine is the same platform of a vaccine as the Pfizer vaccine. It is an RNA vaccine as well. That study data will be presented at the VRBPAC meeting this week, just like it happened last week with Pfizer vaccine. The VRBPAC committee is the independent advisory committee to the FDA. They will be discussing the Mrna vaccine results this week and then reporting to the FDA. FDA will then likely rapidly turn around an EUA for the Mrna vaccine, which then would allow shipping of the Mrna vaccine shortly thereafter. And so we would anticipate the timeline for this Mrna vaccine to be similar to the Pfizer vaccine in terms of shipping vaccine within 5 to 6 days after the VRBPAC meeting. But again, this is contingent on the FDA approving an EUA for the Mrna vaccine.
And are hospitals still not performing elective surgeries due to high ICU volumes in COVID patients?
Yeah, our hospitals are doing a very aggressive job of matching the surgical procedures to the availability of beds in that facility. And so it is an ongoing procedure where they're looking at this at a day-to-day basis to understand who can they operate on and who should they hold off on based on the volume and the capacity in the hospital.
Okay, let's have Dr. Dascomb rejoin us one more time. I think you answered the question. The bigger hospitals are getting it first. One of the smaller community hospitals expecting it. One question, why couldn't the appointments have already been set up? And to be clear, are you scheduling healthcare workers over 65 with comorbidities first?
We didn't want to schedule any earlier than knowing that we had vaccine available. It has always been a process in constant flux that we have had the ability and agility to adapt to, but given the fragility of this vaccine, we wanted to ensure that it was available first to make sure that we had it available on site and safe before we started inviting caregivers. It would be very hard to have appointments already set up and not have had product delivered. So that was the reason for delaying that. The second question was?
Are you scheduling healthcare workers over 65 with comorbidities?
We are. We are trying to do that more at the unit or within a caregiver group level, if that's an option. However, we are also focusing on things like our scheduling issues to ensure that we can maintain the census of our caregivers within our facilities as well.
And we've got several different questions regarding prioritization, both within the hospital and with the community, such as patients or teachers. Why don't you just go ahead and explain again the process that prioritization took place with UDOH and our other partners?
So our health department, our health system, the University of Utah, many other health systems all came together to really decide who within the caregiver group should go first. 1A was already decided by CDC to be the healthcare workers, as well as those who are in long-term care facilities and those workers. The health department is mostly taking responsibility for those patients. Within our facilities, we agreed upon our prioritization to start with those who have most exposure to COVID on a day-to-day basis. These would include our ICU workers, our medical surgical personnel, our environmental service workers, and lots of other folks along the way that work in those units. After that, we would offer it to those who are in facilities. In our case, because we have several facilities now taking care of COVID patients, we would also try to offer it to those who are in those positions at our other sister facilities in the area, in the region. So we will continue to offer it as much as possible to those who are at most risk. After that, we will start offering it to those with a slightly less risk, such as those who are in primary care roles, who don't see as much active COVID, but still see patients frequently. Those like me who see patients in their own clinics. Those who are otherwise healthcare workers who are in and out of facilities but don't necessarily have the direct patient contact that a COVID healthcare worker would have. And so there are tiered prioritizations within that 1A category, but ultimately we'll get to all of our healthcare workers. After that, you have a 1B category, which includes the vaccination of our frontline workers in our emergency areas, such as those who work in ambulance care. For example, those will be in 1B. And then right after that, you'll have those in our high-risk community folks in 1C. So we'll move, in 2. So we'll move very quickly, as quickly as we can anyway, to get to all of those in succession.
Excellent. And do you have enough personnel to administer the doses you have? Will personnel eventually be an issue in terms of administering the vaccine?
We saw that as a very great concern early on, and so we addressed it very early on. We normally have our educators and our employee health nurses administer our flu vaccinations, for example. We do see this as being a longer and need for more sustained vaccination. And so to support that, we have asked many of our nursing staff, our physicians to volunteer. We've asked a lot of different folks to come forward and really help train to do this and to help support us, especially in a time when we may be having limited staffing during holiday seasons. So we do see a really strong willingness to support this process. And so we don't anticipate any issues in the near future.
Okay, we'll have Dr. Stenehjem take the pulpit again. Eric, I'll just say questions about Navajo Nation should probably be directed to them or UDOH. That's not our area of responsibility. So a question was asked, how long will the COVID vaccine last? Will this be an annual vaccine like the influenza vaccine?
Yeah, great question. And the answer is we don't know. The vaccine trials that have been set up for Mrna, Pfizer, J&J, Oxford are all 2-year studies, and we will use that data to determine, if and when immunity wanes after vaccination. So at this point, we're uncertain at the cycle of vaccination for COVID-19 and for SARS-CoV-2. We doubt that it will be an annual vaccine like influenza. The reason influenza is an annual vaccine is due to the constant shifting of the virus, and so we have to constantly update our vaccine to match the circulating strains. We don't expect that to be as much of an issue with SARS-CoV-2, and so we hope that we don't have to vaccinate yearly and that we will be guided by the studies that will be forthcoming in terms of duration immunity after vaccine administration.
Right. And why is it recommended to get the vaccine even if you've already had COVID?
Right. Right now, CDC, ACIP is all recommending everybody to get this vaccine, regardless if you've had documented COVID-19, either through an antibody test or a nasal sample. There is a chance that the vaccine actually may provide more long-standing immunity than actual infection. In addition, the complexity of trying to perform antibody testing on people prior to getting vaccines will be a very large challenge. So at this point, all recommendation is to get vaccinated regardless of your history of COVID-19. The data that has come out of the trials show that this vaccine is safe in people that have had prior COVID-19 infection.
Excellent. Thank you, Dr. Stenehjem. We've got a couple last questions that we'll give to Dr. Dascomb. It was asked, was there a reason Utah Valley and LDS Hospital got shipments first? Do you know when University of Utah is expecting their first shipments?
I do not know that answer. It may have to do with paperwork completion, but I do not know the answer to that question.
And did you say how many workers will be vaccinated this week? Do we have an expectation?
I do not know that number offhand. We have just sent out our appointments today, and so as they are filled and as our shifts are filled, we will be able to give more information about how many were completed by the end of the week.
Excellent. And why are ER staff members in 1B and not 1A?
They are not in 1B. They are in 1A. ER staff members are in 1A. I may have misspoken before, but I meant to say that those who work in emergency positions such as ambulance and in the community are those who are in 1B.
Thank you for that clarification. Someone is asking, I think I gathered that all Intermountain Healthcare facilities could soon get vaccine, not just our 4 centers. Is that correct?
Yes, that is correct. We have submitted applications for 22 of our 23 facilities, and we do anticipate that shipments should be coming out over the next weeks.
And there was a ask for clarification if we know how many total vaccines will be shipped to Utah.
In what time frame? I think we're thinking of the first week, and if that's the case, we anticipate that it was 23,000 doses, not just to our facilities, however, across all facilities and systems.
All right, and one last question. Where will shots first be given at Intermountain?
My understanding is they will first be given at Utah Valley Hospital on Wednesday evening.
Okay, actually we have one more question that we're going to give to Dr. Stenehjem. Despite the news of vaccine coming out, why are we still stressing the importance of masking and social distancing?
Right. I mean, as Dr. Dascomb mentioned, this vaccine rollout will take some time. It'll take some time for us to get the healthcare workers vaccinated and then also get our community vaccinated. we need to maintain our sound public health measures to ensure that our communities are safe. We won't have widespread community vaccination for months now. And so we have a number of months where we are still in this same situation of very high community transmission of SARS-CoV-2, which will lead to increased cases and deaths and morbidity. And so it's incredibly important until we can get the vast majority of people that are at risk for severe outcomes, until we can get all of those people vaccinated to keep them safe in our communities, we're going to have to be focusing on masking and social distancing. It also needs to be stated that the Pfizer study looked at symptomatic COVID-19 as their endpoint. It did not look at whether or not people could get infected and remain asymptomatic and continue to transmit the virus even if they themselves don't get sick. And so that has a very important public health consequence in the fact that even if you're vaccinated, you may still be able to transmit virus to those that are at high risk for negative outcomes if infected. So it's going to be very, very critical that we all maintain these great public health practices that we've been doing over the coming months. And we will be working with the Utah Department of Health as we go from spring into summer and really evaluating our data in terms of the number of cases in our communities. And we will rely on the Utah Department of Health to guide us in when we can lift some of our public health precautions.
Thank you, Dr. Stenehjem. Thank you to each of our experts, Dr. Kristin Dascomb, Dr. Stenehjem, and Sean Talley.